Hello everyone. So today I am starting with assignment number 5. First question, study design useful for describing uncommon clinical manifestations. Yes, both. Case reports and case series both are good study designs. Both A and B. Then cross-sectional studies are used to estimate prevalence. Yes, they are used. Generate hypothesis. Yes. Describe trends. Yes, all of the above. Correct. In a cross-sectional study, we can observe one or more outcomes. Yes, we can. That's true. Which one of the following is useful to measure the burden or magnitude? I told you burden or magnitude is always measured best by cross-sectional study. To measure the burden or magnitude, that is the prevalence. Cross-sectional study is the best. Then which of the following is wrong about descriptive study designs? Describe the study outcome for one group. Yes, this is right. Compare. Yeah, in descriptive we never compare. Comparison, all of you should remember that descriptive or observational studies are never used to compare anything. They are only used to describe stuff. For comparison, we use experimental or analytical studies, like we can use randomized controlled trials, something of that. Incidence, yes, we can calculate incidence, yes. Prevalence also, yeah, yeah. Comparison, wherever you see this word compare, just get it in mind that compare basically means it is an experimental or analytical study. Then descriptive epidemiology study designs can answer all of the following question except why. Yeah, why? The reason, because reason you need to get by experimental or analytical studies. Who, when, where, this you will come to know. But the why you will come to know by if you go in an experimental or analytical study. Then which one of the following study designs does not employ comparison groups to answer the primary study objectives? Yeah, cross-sectional study. Cross-sectional study never employs any comparison groups. Then unit of observation in the cross-sectional study is an individual. Yes, that's right. Case reports can include presentation of unique features, symptoms, rare manifestation, everything, all of the above. Advantage of ecological studies to relate rate of disease and exposure. Yes, true. Advantage of ecological studies relate rate of disease and exposure. Then a researcher can assess the following by conducting a descriptive study except population, yes. Individual period, yes. Risk factors, no. Risk factors he or she cannot know. Place distribution, yes. This he or she can know. The following study design provides group exposure and group response outcome without knowing the individual exposure and response for a specific health problem. Ecological study. Ecological study, yeah. Group exposure and group response without knowing the ecological study. Then which of the following study design will be helpful if the Department of Health wants to know the burden of a particular disease? Cross-sectional survey. Cross-sectional survey. Then a clinician comes across an unusual presentation of a particular neurological disorder. If the clinician describes the single case in detail and publishes the same in a journal, it will be called case report. Yes, that's right. Advantage of an ecological study is that it will be useful to generate hypotheses. Yes, true. No, it is not analytical. Cover individual level, no. To generate hypothesis, ecological study. Then in a tertiary care hospital, a surgeon collected information on quality of life and outcome among a small group of post-operative patients. But this is not sufficient to establish the efficacy. Yeah, because obviously there is no comparison group. True. Maximal effect, maximal response is efficacy. This can be inferred only when there is a comparison group. Population consensus is a cross-sectional survey. That's true. Cross-sectional surveys, population surveys, cross-sectional surveys. After that, one of the major limitations of a cross-sectional study is that it does not establish disease etiology. True. It is time consuming. No, it is not time consuming. And it does not require even a large sample size. It can be done in a smaller, but it does not establish, this is true. Then characteristic of a cross-sectional study is that exposure and outcome are assessed at the same time. Yeah, that's true. Exposure and outcome, yes. Not difficult to conduct, very easy to conduct. Then if a researcher wishes to estimate the incidence of myocardial infarction case among a group of women using OCPs followed by 10 years. Yeah, cohort study, true. Because incidence, see, whenever there is incidence is new cases. So new cases you can only get in a cohort study, not in a case control. Case control you have cases and controls. That is a retrospective study generally. Cohort study can also be retrospective and prospective, it depends. Then case series are useful to describe uncommon clinical manifestations. True. Yes. I also submitted a case series in the international journal for publication. Then all of the following are true about cross-sectional survey except involves only incident cases. Yeah, this is false. This is absolutely false. It can never be, because it will not only involve incident, it will involve incident as well as prevalent cases. Yes, it estimates a burden of a disease. That's true. Can be used to generate hypotheses. Yes, individually. Yes, true. A detailed presentation of a single case, which is rare and familiar, is case report. We are following is incorrect about ecological study. It uses individual level data. No, this is false. A lot of population is involved. Yeah. We are following not applicable in a case study. Clinical features, yes, have incidents. Yeah. Incidents, because it involves a larger population. Then determine the association between air pollution and male infertility. Data was prevalence was created for 183 countries. Yeah, this is ecological study. Correct. So many countries. So this is ecological study. In a medical journal, 18 cases of CJ disease were reported from Sikkim. Author's description. This is a case series. Yeah, true. Obviously, case series. Which are following is false about cross-sectional studies. Can be used to establish temporality. No, we can never. Temporality is time factor. Time factor we can never use. Because in cross-sectional surveys or study, you are taking the person at that particular moment. That's why. State whether true descriptive cross does not have a comparison. That's true. Which of the following studies can be used to identify factors associated with an outcome? Analytical. Comparison wherever there is analytical. Okay, this finishes assignment 5. Bye.